Thank you all for having me. I always learn a lot more in these forums than I think I convey, but so I'm excited to be here. My name's Paula Reeves. I work for Department of Health, which I'm fairly new at health, a couple years in, but I've been doing community design work for about 25 years now, which is hard to believe. I've worked at the local level. I've worked at the State Department of Transportation for 18 years of that time, in private consulting work doing community design. My background, my undergraduate work is largely in history, believe it or not, and a minor in biology. And then I went to architecture college and got my degree, my master's degree in urban and regional planning. And I'm a student right now too. I'm a law student at Northwestern California University in Sacramento, which is kind of interesting to put the legal aspect on it. And I want to talk to you about community design and health and how these things, I think, are coming together in new ways, and you all will be the implementers of all this in your work in environmental as you move out and take over from all of us moving away from it.
Well, do you want a remote?
Yeah, that'd be handy dandy. That's okay, I can do it right now. So I'll talk a little bit about what community design is, because I think everybody sort of has probably a picture of it, but I want to make sure we're all on the same page there. And then some trends in health and community design that we're seeing, and also emerging policy, so kind of where we're at right now, and you can imagine where to take it from there. Let's see if I can. So when I say community design, I mean all the zoning, the land use laws, the zoning ordinances, our development regulations that shape what buildings and infrastructure look like, and our permitting processes. And a good example here, I think, is this. This is a good example of community design. This is a small trail that costs less than $1 million in Bonnie Lake, and it connects, you know, a giant area of housing on one side of this ravine, this watershed area, with the school area on the other. And as a result of this small urban investment, the school district was able to cut 10 bus routes, and the trail essentially paid for itself in less than a year. And in the process, got a lot of kids out there. You go out there on any given day, and kids are walking and biking and, you know, understanding the way the watershed fits into their community and the importance of it. And it sounds like you're going to talk about water next. I want to come back for that. So anyway, that's a good example. And it's, you know, it's about working out the details of infrastructure costs and investment. So I've got a little picture there just to give you a sense of, you know, in the roadway there's just a lot of infrastructure and a lot of working out details and working with different parts of a city to put that all together. And I noticed your transportation planner from Bellingham walked in the door, so I want to just give a shout out to Chris Como here. He's working with this stuff directly day to day. So how does community design get done? This is kind of what it looks like. Community design happens in these forums, you know, your standard public hearing kind of thing up there on the top left. You know, walking audits, people going out and looking at the infrastructure with elected officials and the public. It happens in these kind of forums. We call those storefront studio, where you go into a storefront and put renderings and drawings up and talk to people about what that might look like. And just to give you a visual on how's it go down. And what our process looks like here in Washington State is up there at the top. It starts with countywide planning policies. And these are policies that every jurisdiction in the county needs to be consistent with as they shape their plans and their processes. And down at the bottom is, you know, building occupancy as you go through the process. And normally the public starts to get interested right around here. This is where we start to say, wow, if you do that, that's going to be hard on my neighborhood. That's going to impact my health and my community. That's when it's way too late. This is right here where health needs to be inserted. It needs to be inserted in comprehensive plans. It needs to be, you know, present in that part of the decision-making process. So starting to move into a discussion of trends, I just wanted to tell you that we're spending as a state roughly $12 to $15 billion annually on community design work in the state at the local and state levels. This is investment in highways, roads, community development projects, parks, trails, other things you think of when you think about community design. And so it's starting to filter those decisions to make a shift in our public health. That's what I'm talking about. And when we talk about health, you all probably picture doctors and nurses, hospitals, health care. But health care is really a small portion of what actually makes us healthy as people. It's really about how we live and where we live that determines how healthy we are. We know that now. The research is deep and broad, and we're starting to look as a society, I think, at all these other parts of health, our behaviors, you know, eating right. That's been something we've talked about for 30, 40 years. But now knowing, you know, more about air quality and water quality and being able to walk and be physically active, that's a bigger part of the picture. So, you know, the fundamental building blocks of the health and how healthy you'll be and how long you'll live are really determined by your quality of education, your built environment, your access to parks, the way, you know, the kinds of access you have in your social situation. And I just threw this quote in just to kind of, this is really what the healthy community design is focused on. Recognizing that, you know, over the decades we've spent billions of dollars. We spent billions of dollars in Washington State, and we're moving that health needle in the wrong direction. We still haven't managed to create a human environment that gives access to all in public health. And this is very important right now, I think, because Washington State is growing really fast. We're growing fast. I want to make sure, by 2026, which is literally tomorrow, I mean, 2020 is just now, we'll see 8 million people, and 6 million of those will be in our cities. So we're growing fast, and that doesn't look like it's stopping anytime soon. Another trend that we're watching and that we look a lot more at, we used to look at the cost of housing, like you think, I could buy a house further out of the city and pay less for it. And you know, now we're starting to bring together the cost of housing and transportation to really give a full picture. And HUD, the Housing and Urban Development Organization at the federal level, says that 45% of your monthly income is really kind of maximum for the combined cost of housing and transportation. That allows you to still have resources to spend on food, medicine, other recreational activities that you need, and other services. And right now in Washington, on average, 52% of our monthly income is going to this combined housing and transportation expenditure. And this graph is a little complicated, but here, moderate income households, it shows, so on the lower end of the income spectrum, are spending a lot more on this combined housing and transportation monthly portion of their income than the wealthy on the above median income. So we have an equity issue in our system. And it's kind of a combination of housing location and transportation accessibility. That paradigm where you can move out and spend less on housing and have more usable income is kind of flipped now. When you can afford housing in an urban area, you have access to a lot more services. So this is starting to become clearer. Another trend I'll mention is in transportation safety. And this line here, this line is what we call our target zero goal. And this is the state highway safety plan says that, by 2030, we will achieve 0 fatalities on our roadway. We'll make the right strategic investments and we'll get there. We'll get to 0. And after the economic downturn in 2008, we're definitely seeing an uptick. And a lot of that has to do with, about a quarter of the 563 fatalities on the state system or on the road network out there are now bicyclists and pedestrians. And that's a paradigm shift too. More people out biking and walking, we're seeing higher numbers of crashes in that arena. And so annually, roughly 700 children involved in bicycle and pedestrian traffic crashes. This is definitely a community design issue. Most of those are trying to cross, so high-speed roadways. And also disproportionately represented are the aging population. And so paying closer attention to these people in our community design decisions and housing location decisions, very important. We have this great map that I'll make mention of. It is called the Health Disparities Map, and it's just been done in partnership, Department of Health working with an organization called Front and Centered, and with University of Washington, developed this map. It basically shows locations in the state where we know we have health disparity. So we know that, a certain census tract has a longer life expectancy than another. And we know, a lot about the community design in each of those areas so we can make those comparisons. So this is a great resource if you want to go out and check it out. It's I brought some little one-pagers on it, and my card is also up here if you have questions about it. But this has just been published literally 2 months ago, and there was a bill out, I'll talk about that in a minute, called the HEAL Act that would have made it mandatory for agencies planning and investing in infrastructure to consider these areas that are disproportionately represented. So in air quality, we know that high poverty neighborhoods suffer more in terms of being close to major roadways with high traffic volumes and greater exposure to air pollution, namely diesel particulate emissions. So as a result, they see higher rates of asthma, cardiovascular diseases, lung development in children is impaired. Also, low birth weight is an outcome that's common in these areas, and childhood leukemia and premature death, which I'll talk about that in a second too. A couple other stats that I think are really important. Right now, 1 in 9 people in Washington live below poverty. I'll just tell you, I was just in San Francisco, and we were talking about affordable housing. We were looking at these massive housing developments and talking about affordability, and they were talking about 40% of this new building will be affordable. And we asked about what does that mean, 80% of average monthly income. And we quickly did the math, the group standing around this planner, and realized they were talking about us. Public sector planners fall into the category of needing affordable housing in San Francisco. And I think that trend is not limited to that particular city. Seattle struggles with affordable housing. I know there's an affordable housing workshop here in Bellingham tomorrow that I'm attending, and so the discussion is really national right now. Some of the challenge is related to our housing stock. So what's been built out there over the course of history. And right now in Washington, about 60% of the housing stock, the houses that are available, are single family detached with 3 or more bedrooms, mostly built, 60s, 70s, 80s. And that is not matching up with the average household size and what people really want and need. So it's about trying to come up with a different type of housing stock and infill where it's an opportunity and retrofit some of those single family homes to be more like what is needed by the population today. I mentioned bicycle and pedestrian traffic deaths nearly doubled in the last few years. And almost 60% of those bicycle and pedestrian traffic deaths are happening in high poverty neighborhoods. Healthcare expenditures are growing at 7% annually in Washington, and this is higher than the national average. We should all be concerned about that because we all need healthcare, and it's expensive. It's expensive. Last but not least, this is just a new stat and is connected to the built environment. Our healthy use surveys, you may have read, I actually read an article in your local paper about this particular topic. There's a lot of concern about youth suicide rates. And the stats from Whatcom County are aligned with this. 10th grade classroom of 29 students would contain an average of 3 who have attempted suicide. And we have to stop and ask why. I mean, why is this happening? And you know, there is a connection to the built environment. The research is clear that, you know, spending time in the natural environment is restorative and has good mental health benefits. These are things that we need to design into our cities. I mentioned life expectancy. This is in the Seattle area. I won't really, no need to call out neighborhoods, but this is a neighborhood that has a very high life expectancy. So the blue, dark blue, is you're going to live in, you know, well into the later years, and then on down into the red where life expectancy is lower. Just adjacent tracks will have a disparate life expectancy of 10 years. That's striking. It's striking, and it should concern us. And related to that is our healthcare costs. I just took kind of an international look at this just to show you, and then also show you where we're at in Washington. We see very high healthcare costs with not you know, aligned value in terms of our life expectancy. So average $8,700 per capita annual healthcare costs, and we're on the lower end of the spectrum in terms of life expectancy. I wanted to introduce these principles that we're working on at Department of Health. These are community design principles that we can sort of tout to other state agencies that are making these investments, and also to cities and counties and tribal nations and other jurisdictions that invest in infrastructure. Point out that these are sort of goals and maybe a filter when they're considering a housing investment or a major transportation investment or major water investment, that they consider that these expenditures really achieve these goals. This is something that we're working on at Health. It's a work in progress. You know, I'm always open to feedback about these things. If you see something glaringly, you know, being omitted, like I said, I usually learn more from you guys than I have to convey. So reducing environmental exposure, I mean, these are kind of no-brainer things, but things we should ask ourselves: are we achieving these things with this investment, or is this investment making some of these things, you know, worse potentially? So reduce environmental exposure. So toxic exposure, obviously we want to, you know, limit housing near toxic waste sites or sites that haven't been fully remediated. Enhancing healthy natural systems, increasing safe, healthy, active living, ensure emergency preparedness. That's our climate item. And integrating health equity. Health equity is, you know, it's a very important, last but not least, kind of goal there. So, and it's important for us all because we bear the burden as a society of the costs of inequitable health care. So I will mention these a few more times in my talk. I just wanted you to have a picture, so I kind of highlighted that. Some actions that we are, in my shop, are taking today to help along these lines. We're developing a finer grained scale of data, that health disparities map that I mentioned. Encourage you to go out and kind of play around with our Washington tracking network and see what data is out there. And remember in your future lives that that's there, and you can use it in all sorts of work you do. More cross-disciplinary data sharing, so getting together with other agencies like Washington State Department of Transportation and making sure that they know about this health equity data and that their investments support improving and reducing health disparities. Academic outreach, I do a lot of talks like this, and we have a lot of internships at Washington State Department of Health. Of course, you have to be in Olympia, but there's some great work going on there in public health as it relates to the environment, not just the built environment, but our water systems and radiation exposures, and these things go on in environmental public health. We're modernizing Washington's planning and community design laws. So I said, what is community design at first? It's the zoning and the development regulations, and it's how we lay out our cities. Well, the laws that govern that are being modernized right now. They were originally passed in 1991 in the Growth Management Act of our state. And that process is being revisited by the Ruckelshaus Center, and they're coming out in June next month with a report called the Roadmap for Washington. And it will have a lot of high aspirational goals that hopefully our legislature will take over time and make our Growth Management Act more effective. We are also, I think most importantly, we're translating those goals that I showed you, the principles for healthy community design. We're translating those into at local level, at state level, into design standards, our contracts, plans, and policies, and health impact assessments. Health impact assessments are a big part of my work, and what a health impact assessment is basically a plan, and it evaluates a major development or a major policy shift for its impacts on public health. So, for example, we just finished the Millennium Bolt Coal Terminal Health Impact Assessment down in Cowlitz County, Washington, where we looked at what was going to be the largest coal terminal in the western U.S. For its potential impacts on public health. And quickly, using our health disparities map, we found that an already impacted community was very nearly adjacent to the coal terminal. These are people that are already suffering from lung disease and obesity and diabetes and other conditions. Their rates are already higher than the state average. And just bringing that out it helps to make better policy decisions, helps the applicant for permits, the coal terminal company, gives them options for mitigation and things like that. So that's important work that we're continuing. So academic outreach, like I said, this is a Bastyr. We did a workshop there on community design where they actually got pen in hand and did some sketches and things, and that was really fun. And these are health students, not architects. So just kind of letting people cross that line and think about new ways to incorporate community design in the work you do each day. Oh, I was saying about health impact assessments. It's kind of like how a doctor, if you think about how a doctor advises a patient when they come in and say, I don't feel well, and the doctor says, well, here's some things that can make you feel better. Here's some medications. Do this sort of physical activity, get another test, that sort of thing. That's kind of what a health impact assessment is for a community or for a site that's being developed, if you want to think about it that way, in simple terms. And it will look at like near-term effects, environmental effects, mobility, connectivity, economic development opportunities, which we know are really directly connected to public health, and modifying factors. I mentioned health disparities, health behaviors, demographics, and outcomes. Toxic exposures, changes in obesity rates, heat-related illness is something more and more important to evaluate. I mentioned low birth weight, birth outcomes. And just to give you some examples of how we're integrating these concepts and these goals into sort of day-to-day local decision making. This is sort of applying healthy community design principles to a roadway. You know, how does that actually play out in design? And this bottom image is sort of everywhere USA, you know, multi-lane, wide, fast, potentially 45, 50 miles an hour. Not a lot going on here. Nobody's really excited about walking right there because cars are zooming by you and it's dirty and it smells and bad air, and you know, it's hard to cross. Really, you sometimes take your life in your hand running across that type of a roadway. This is the same right of way, exactly. Carries the same volume of cars, trucks, so forth, people. Carries, I think, people much better. Essentially what it does is it moves the traffic into the center of the right of way and takes additional right of way. Obviously this is going to be slower, but in congested times, everything moves slow, you know, so it's sort of a give and take. But it allows for a lot better buffering from, you know, emissions. It allows infill development. It's a lot nicer to live in in some kind of a situation that's here versus, you know, here. So that's just an example of how that would be integrated and better meeting those healthy community design principles. Kind of seeding ideas by showing ways that arterials can be retrofit. And I don't really need to tell you, see this when you go out in your community here in Bellingham, more than many cities around the state. Bellingham has done some amazing work in providing infrastructure like this. So you can see these examples day to day, but it makes a giant difference. So this is a great one. Just really low cost, sort of superficial surface investments that can completely change accessibility and walkability and make it a lot nicer to be out there. You know, this lot was to be a gas station, another corner gas station, and the community rallied and got together and said, no, we want community space instead. And the city purchased it in this case, and social interaction space is really important. This is integrated water management, or also called low impact development, and I imagine that when you talk about water next week you'll hear about some of these things, so this is kind of a good entree. But this is a school, and this is a parking area that's using a surface that's long lasting and also filters the water. So it isn't going into pipes and vaults, and a lot of times these kinds of retrofits can save a developer money and also help ensure that water infiltration is happening in a healthy way. And they've also incorporated some rainwater harvesting. This happens to be in Snohomish County. I don't know if you know that, but you may be interested in visiting this location. It's quite innovative. And at the same time, they're teaching students about this with signage and things. So last part of my talk, I wanted to talk to you about some emerging policies. And I'm really excited about this. This session, I'm in Olympia, and I exceeded my record of bill analyses this session. I did 160 bill analysis for the Department of Health, and I'd have to say that this one is my all-time favorite, the HEAL Act. It was put forth by the organization I mentioned before, Front and Centered, and they used that health disparities map that we've developed, and it called for creation of a state-level task force that would incorporate environmental justice into all of our policies and practices in the built environment development. The cumulative impact analysis is something that we don't do today. We do a environmental impact review, but it isn't a cumulative impact analysis. So that's something we're starting to talk about more. It's like all of these different impacts compounding in the urban setting, and how does that affect public health. And they called for the development of some model policies. And so it was interesting back and forth, passed the House, not the Senate, and then ended up getting incorporated into the budget as a proviso. So we did see some provisions. So in 2020, well, it's in the budget for this year. In 2020, this Environmental Justice Task Force will be created. At the state level, it'll be the secretaries of all of the major infrastructure agencies, Department of Transportation, Department of Commerce, Ecology. It will include other partners like our tribal nation partners and others, and they will have to do some good work. And I'm excited about helping support that at DOH and seeing the outcomes and how that is integrated and changes the work we do. This is sort of a picture of what our Washington Tracking Network tool looks like, the health disparities map I mentioned, and there's the website. It's pretty easy to understand, and it's easy to kind of pick categories and, you know, take a look at exposure to hazardous waste sites, where are they, exposure to air pollutants and what kinds and where are they, you know, so take a look at that. I mentioned the roadmap coming out in June. This is important policy, and the state laws that will be reviewed as part of that modernizing our Growth Management Act are pretty broad. So you can see this evolution and integration of health and the built environment. And we just had a governor proclamation come out recognizing public health practitioners, which just makes me happy, feeling a little recognized, and I think that's cool. And before I stop and hopefully you ask a bunch of flood of questions, I want to leave you with some final policy questions to think about going forward, kind of where I think we're at. You know, there's this quote from this gentleman who used to be the National American Planning Association president. He says, to be effective, urban planning needs to dig deeper than obscure code, pretty pictures, and jumbling data. It needs to make a difference in the lives of people. And so while we do environmental impact assessments, we do EIS work on big projects, we often exclude that discussion about public health. And I just encourage you all to think about the connection between, you know, development, environmental review, and public health as much as you can going forward. And simply asking a few questions. Can cities and regions prosper more fairly in this equity discussion? Is the affordable housing crisis in targeted places solvable? And can we provide affordable housing? Are cities prepared for significant demographic, cultural, and climatic changes coming in the near future? Are we ready? Are we doing the preparation and adaptation work? Should urban plans and projects be scrutinized for public health impacts? And should transportation planning reorient from cars to people? And that's super interesting as the autonomous vehicle discussion expands. And I'll just point out that we did pass a law this session that will allow these personal delivery devices. They are about this big and about that tall. They look like a cooler on wheels, a refrigerator on wheels, and they are autonomous. They can't weigh more than 120 pounds or go faster than about 10 miles an hour, but they are now pedestrians. So we'll begin seeing those about, I think. It's sort of interesting to see how that will change the urban setting. So that's what I had to talk to you all about. It would not be a public health presentation without copious citations. So please take a look at those if you're interested in more information, and my contact info, and I put some cards up here. And if you're interested in any kind of internships, health has many. Over the course of a year, we have a lot of interns, so if that appeals to you, please let me know.